Have you ever found yourself wondering if you're doing everything you can to stay healthy? Maybe you've been feeling a bit under the weather, or just want to ensure you're on the right track as you age. It's completely normal to have these thoughts, especially as we enter our senior years. The truth is, taking care of your health becomes increasingly important, and one of the best ways to do that is through regular health screenings. Today, we're diving into a crucial topic: essential health screenings that every senior shouldn't skip. These tests are not just routine. They're vital tools for keeping you informed about your health, catching potential issues early, and ultimately enhancing your quality of life. In this video, we'll go over 5 important screenings that can make a real difference in your health journey. So, let's get started. First up is the annual wellness visit, often overlooked but incredibly important. This visit is your chance to sit down with your healthcare provider and discuss your overall health. It's not just about checking your weight or blood pressure. It's about taking a comprehensive look at your health status. During this appointment, your doctor will review your medical history, assess your risk factors, and talk about any changes you've noticed in your health. Think of it as your personal health checkup. It's a time to ask questions and voice concerns. For instance, if you've been experiencing unusual fatigue or changes in your appetite, this is the time to bring it up. Your doctor can provide guidance, suggest necessary screenings, and help you set health goals for the year ahead. Now, let's transition to our second essential screening: blood pressure checks. High blood pressure, or hypertension, is often called the silent killer because it typically has no symptoms. Regular monitoring is crucial, especially as we age. If left unchecked, high blood pressure can lead to serious health issues, including heart disease and stroke. So, how often should you get your blood pressure checked? Ideally, you should have it measured at least once a year, but more frequent checks may be necessary if you have a history of hypertension or other heart-related issues. Learning to manage your blood pressure through lifestyle changes such as diet, exercise, and stress management can significantly improve your overall health. Speaking of lifestyle changes, let's talk about cholesterol screenings, which brings us to our third essential test. High cholesterol levels can lead to heart disease, and many people may not even realize they have high cholesterol until they undergo a blood test. The American Heart Association recommends that adults over 65 have their cholesterol checked every year. But what does this test involve? It's quite simple. A healthcare provider will take a blood sample, usually after fasting for at least 9 to 12 hours. This test measures your total cholesterol, LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. Understanding these numbers can empower you to make better dietary choices, whether that means incorporating more heart-healthy foods or avoiding saturated fats. Now that we've covered the annual wellness visit, blood pressure checks, and cholesterol screenings, I hope you're starting to see how these tests create a comprehensive picture of your health. They empower you to take charge of your well-being and make informed decisions moving forward. As we continue, let's move on to our fourth essential screening: diabetes testing. This is particularly important if you have risk factors like obesity, a sedentary lifestyle, or a family history of diabetes. Diabetes can lead to numerous complications, but early detection can help you manage the condition effectively. The American Diabetes Association recommends that adults over 45 get screened for diabetes every 3 years. This can be done with a simple blood test that measures your blood sugar levels. If your results show elevated levels, your doctor may recommend additional tests or lifestyle changes to help keep your blood sugar in check. Finally, let's discuss the fifth essential screening: cancer screenings. As we age, the risk of certain types of cancer increases, making regular screenings crucial. Depending on your gender and family history, you may need screenings, blood pressure checks, cholesterol screenings, diabetes testing, and cancer screenings all play crucial roles in maintaining your health as you age. Remember, being proactive about your health is one of the best gifts you can give yourself. It allows you to catch potential issues early, manage existing conditions effectively, and enjoy a better quality of life. So, take that first step. Schedule your next health screenings today. Your future self will thank you for it. As we continue our discussion, we'll delve deeper into the importance of these screenings and how to advocate for your health in the next part. Together, we can ensure you're not just living longer, but living well. Now that we've covered the 5 essential health screenings that every senior should prioritize, let's delve deeper into how to prepare for these screenings and make the most of your doctor's visits. It's one thing to know what tests you need, but it's equally important to approach them with confidence and clarity. After all, your health is your most valuable asset, and being proactive can lead to better outcomes. First, let's talk about preparation for your annual wellness visit. This is your golden opportunity to have a thorough discussion about your health, so it's crucial to come prepared. Start by jotting down any changes or concerns you've noticed in your health since your last visit. Have you been feeling more fatigued than usual? Have you experienced any new pains or symptoms? Writing these down will help ensure you don't forget to mention them during your appointment. Also, think about any medications you're currently taking, both prescription and over-the-counter, as well as any supplements. It's important for your healthcare provider to have a complete picture of what you're consuming. If you've had any recent lab tests or screenings from other doctors, bring those results along too. This information can provide valuable context for your doctor. Now, once you're in the appointment, don't hesitate to ask questions. This is your time, so make the most of it. If you don't understand something, ask for clarification. If your doctor mentions a test you need, inquire about why it's necessary and what the results might mean for you. Engaging in this way not only helps you feel more informed, but also fosters a collaborative relationship with your healthcare provider. Next, let's discuss how to approach your blood pressure and cholesterol screenings. These tests are typically straightforward, but there are a few things you can do to ensure accurate results. For blood pressure checks, try to relax before the measurement. Stress can elevate your reading, so take a few deep breaths and sit quietly for a couple of minutes before the test. If you have a history of high blood pressure, consider keeping a log of your readings at home. This can provide your doctor with valuable insight into your patterns and help guide treatment decisions. When it comes to cholesterol screenings, remember that fasting is generally required. This means no food or drink except water for 9 to 12 hours before the test. It might feel inconvenient, but fasting helps provide a clearer picture of your cholesterol levels. While you're preparing for the test, think about your diet in the days leading up to it. Opt for heart-healthy foods like fruits, vegetables, and whole grains to give your body the best chance to show favorable cholesterol levels. Moving on to diabetes testing. If you're at risk, it's essential to keep an eye on your blood sugar levels. If your doctor recommends a fasting blood glucose test, follow the same fasting guidelines as for the cholesterol screening. For those already diagnosed with diabetes, regular monitoring at home can be a game changer. It allows you to understand how your daily habits affect your blood sugar, helping you make informed decisions about your diet and lifestyle. Now, let's talk about cancer screenings. Preparing for these tests can vary based on the type of screening you're having. For a mammogram, for example, it's a good idea to avoid using deodorant or lotion on the day of the test, as these can interfere with the results. For a colonoscopy, you'll receive specific instructions about dietary restrictions and a cleansing regimen beforehand. Following these instructions meticulously is crucial for an accurate assessment. Remember, it's completely normal to feel a bit anxious about screenings, particularly those that involve more invasive procedures. Acknowledge those feelings, but try not to let them deter you from getting the care you need. Bringing a friend or family member for support can help ease that anxiety and make the experience feel less daunting. As you navigate these screenings, knowledge is power, and understanding your health status can lead to informed decisions about your lifestyle and care. After your screenings, make sure to follow up on the results. Schedule a time to discuss them with your doctor, even if the results seem normal. Understanding your health numbers is vital, and if anything is out of range, it's essential to develop a plan for addressing those issues sooner rather than later. This brings us to the idea of being your own health advocate. Don't hesitate to voice your concerns and preferences. If you feel something isn't right, or if you have questions about a proposed treatment plan, speak up. Your healthcare team is there to support you, and they appreciate when patients take an active role in their health. As we wrap up this part of our discussion, I hope you're feeling more empowered to approach your health screenings with confidence. Being proactive and prepared can make a world of difference in how you navigate your health journey. Remember, these screenings are your allies in maintaining a healthy and fulfilling life. In our next part, we'll explore how to interpret the results of these screenings and what steps you can take based on those findings. Together, we'll ensure you're well-equipped to manage your health and make informed decisions moving forward. Your health is a lifelong journey, and I'm here to support you every step of the way. Now that we've discussed how to prepare for your health screenings and how to make the most of your doctor visits, let's dive into what those results mean and how to interpret them. Understanding your health information can feel overwhelming, but it's essential to grasp what these numbers indicate about your health. This knowledge empowers you to make informed decisions and take proactive steps for your well-being. First, let's talk about the results from your annual wellness visit. During this appointment, your doctor may perform various assessments, including a physical exam, discussing your medical history, and reviewing any symptoms you've mentioned. Depending on your situation, they might order additional tests. If you receive a clean bill of health, that's fantastic. It's a reason to celebrate. However, if there are concerns, your doctor will discuss them with you, explaining any necessary follow-up actions. One common area of focus during these visits is your blood pressure readings. If your results show elevated blood pressure, your doctor may recommend lifestyle changes, such as dietary adjustments, increased physical activity, or even medication if necessary. Understanding your blood pressure numbers is critical. A reading of 120/80 millimeters of mercury is considered normal, while anything above that may require closer monitoring. If your numbers are on the higher side, don't panic. Many people effectively manage high blood pressure through lifestyle changes and medication, and your doctor will provide a tailored plan to help you. Next, let's break down cholesterol results. When you receive your cholesterol test results, you'll see several numbers: total cholesterol, LDL, HDL, and triglycerides. Here's a quick guide. Total cholesterol should ideally be under 200 milligrams per deciliter. LDL, the bad cholesterol, should be less than 100 milligrams per deciliter, while HDL, the good cholesterol, should be 60 milligrams per deciliter or higher. Triglycerides ideally should be under 150 milligrams per deciliter. If any of these numbers are outside the recommended ranges, your doctor will discuss strategies to improve them, which may include dietary changes or medications. Understanding these numbers can help you make better choices in your diet. For instance, If your LDL is high, your doctor may suggest reducing saturated fats and increasing your intake of healthy fats, such as those found in fish, nuts, and olive oil. This can be a great opportunity to explore new recipes and food choices that not only lower your cholesterol, but also delight your taste buds. Now, let's shift our focus to diabetes testing. If your blood sugar levels indicate prediabetes or diabetes, it's essential to know what that means. A fasting blood glucose level of 100 to 125 milligrams per deciliter is considered prediabetes, while 126 milligrams per deciliter or higher indicates diabetes. If you find yourself in either category, don't be discouraged. Many people successfully manage diabetes through lifestyle changes, which can include adopting a healthier diet, increasing physical activity, and monitoring your blood sugar levels regularly. Your healthcare team will help you create a personalized plan. This might involve working with a nutritionist to develop a meal plan that suits your preference. For example, if you undergo a colonoscopy and polyps are found, your doctor will guide you on the next steps, which may include removal of the polyps and regular follow-up screenings. If you receive a mammogram and it shows abnormal results, don't panic. Further testing might be required, but many women go through this process and end up with positive outcomes. The key is to stay informed and follow your doctor's recommendations closely. As you review these results, remember that your healthcare provider is your partner in this journey. They're there to help you understand what the numbers mean and to create a plan of action. If you ever feel confused or overwhelmed, don't hesitate to ask for clarification. Your health is too important to navigate alone. Let's also touch on the emotional side of receiving health information. It's normal to feel anxious or concerned about your results, especially if they indicate something that requires follow-up. Remember, you have control over how you respond. Focus on what you can do moving forward. If you need to make lifestyle changes, think of them as opportunities to improve your overall well-being rather than burdens. Engage in activities that uplift and inspire you. Whether it's joining a walking group, trying a new recipe, or even finding a hobby that sparks your interest, these positive actions can help you manage stress and boost your mood. Surround yourself with supportive friends and family who encourage you on this journey. Their support can be invaluable as you work toward your health goals. In summary, understanding your health screening results is a pivotal part of taking control of your well-being. Knowing what your numbers mean allows you to work collaboratively with your healthcare provider to make informed choices about your health. Remember to celebrate your victories, no matter how small, and remain proactive in seeking knowledge and support. As we conclude this part of our discussion, I encourage you to take charge of your health screenings. They're not just appointments, they're stepping stones toward a healthier, more fulfilling life. Your health is your wealth, and the more you invest in it, the richer your life becomes. Thank you for joining me today. I hope you feel empowered to approach your health with a renewed sense of purpose and confidence. If you found this information helpful, please take a moment to like this video and subscribe to our channel for more insightful content aimed at helping you live your best life. Remember, you have the power to shape your health journey, and I'm here to support you every step of the way.